What's up, y'all? I'm Dr. Lindsey Matthews Cantu. I'm your BirthFit founder and CEO. And we got a podcast today. I'm trying to look to see what episode this is. Uh, is y'all know we got to stay on track sometimes. This is episode number 270. And as promised, we are talking all about topical progesterone. Before we get into that very specific subject, go to our website, check out the BirthFit certification. Our fall cohort is now open for enrollment. So get in where you fit in. Y'all, let me just say this. Right now, we have a huge problem in the United States. Huge problem. Our maternal health crisis is is not getting any better. Women are showing up to conception, they're showing up to pregnancy, they're showing up to birth, metabolically unfit and powerless. They've outsourced their powers. And as a result, our children keep getting sicker, and women show up to motherhood on the other side of birth. They show up depleted, exhausted, and I'll even say malnourished. So, what is the solution? The BirthFit 7-pillar framework. Y'all, this is for coaches, practitioners, anybody that serves women inside of the motherhood transition. We've got the 7-pillar framework for you. We've got the lifestyle medicine framework for you. Like, could you imagine just pause for a moment with me and imagine the women that you coach, the mothers in your office. Imagine that they show up to conception, they show up to pregnancy, they show up to birth feeling in alignment, more adaptable, more resilient, and absolutely nourished. Their nervous system is just at peace. Like, how cool would that be? And you, as the coach or practitioner, held their hand along the journey. You showed them the way. You gave them the framework. You opened the door for them. You embodied this 7-pillar framework so that they have permission to live the same exact way in their own unique style. How cool is that? Because the way women and fathers are heading into conception, metabolically unfit, that's a lifestyle problem, which requires lifestyle solutions. So, hello, BirthFit. Hello, 7 pillars. Go to our website right now, birthfit.com, click on the certification button, and find out more. Enrollment is happening now. Class starts September, goes through October, first 2 weeks of November. We are done in 12 weeks. You will be BirthFit certified coach or a BirthFit certified practitioner, and you will then be able to lead your local community. How rad is that? You will be the go-to source. All right, let's get rolling. All right, so today, topical progesterone. By the end of this podcast, I want you to know the difference between the 3 tiers of topical progesterone products and why that matters. Perhaps when progesterone is actually needed, which products are the cleanest out there, and how to cultivate the 7 pillars to enhance progesterone production just simply by optimizing our biology. And then maybe when to seek some, external support. So, what the heck is progesterone? Progesterone is a steroid hormone produced primarily by the corpus luteum after ovulation. So you have to have ovulation. You have to ovulate in order for progesterone to happen. So if you're not sure if you're ovulating, let's get some LH strips. Let's test this late morning, midday consistently and find out if you're ovulating. That's step number one. Um, Also, a Dutch test is, I'll say this right away, is probably the most accurate at detecting progesterone levels. And you're going to want to get a baseline, so somewhere around day 1 through 3 of your cycle, and then um, probably 2-ish, 3-ish days after ovulation. Okay, so moving on. Progesterone is not just a reproductive hormone. It gets kind of like placed in that category, but it literally touches virtually every system within our body. Um, Sleep and mood, hello, allopregnanolone. This is a GABA connection. This is why women with low progesterone say they can't turn off their brain at night. Thyroid, low progesterone and thyroid dysfunction co-occur like all the time, especially postpartum. And then what I want to tell you is that progestins, so what you see kind of maybe on products where it says progestin, Tin, are not, that's not progesterone. When a client tells you, also let's clear this stuff up. When a client tells you she's on the pill, a Mirena IUD or Provera, she's not getting progesterone. She's probably actually making or having worse progesterone related symptoms because progestin suppresses ovulation entirely. So always clarify what the heck is going on if they're on some type of birth control option. Um, yeah. So let's let thyroid support, stress buffer, bone density. I wanted to hit on this. Progesterone helps bone health alongside of estrogen and DHEA. Yes, we talked about sleep, thyroid, stress buffer, and then obviously uterine protection. All right, let's move on. So, not all progesterone products are the same, and this is the three I was talking about just a few seconds ago. So, there's an RX compounded biohormonal, like a we'll call it a bioidentical hormone. This is the prescription. It's prescribed by a licensed provider, and they customize a dose based on labs, hopefully. And it's usually measurable, like they use blood labs or Dutch tests. It requires ongoing provider support. Like if you're getting a prescription of progesterone, absolutely, I want ongoing support. Um, and some women might need this, especially with complex hormonal cases. I don't know. Um, I haven't been in that spot, so I don't know what I would do. Obviously, if you know me, you know I'm going to try all the natural alternatives. I'm going to dial in my 7 pillars, which we're going to talk about in a little bit, and then go from there. Um, Number two, this is the over-the-counter bioidentical. Um, it's real bioidentical progesterone, and it's usually about 20 milligrams per pump. That's like the standardized dose. So if you're getting a prescription, you're probably getting more than that. Um, yes, measurable on labs. No prescription is required for that over the counter. This is this would be a good option to support a luteal phase, postpartum, or some perimenopause symptoms, maybe like light symptoms, I'll say. And then the third tier is this yam-based botanical, and it contains a precursor, which is called diosgenin, Diosgenin. Um, the body has a really hard time converting this to progesterone, and it's not measurable as progesterone when you take labs. It might have mild botanical effects, might have like the placebo effect, but it's not like just in my research, and I wish this worked. I wish it worked. But in my research, it's not a solid substitute for a big documented deficiency. And we'll get into that in a little bit later. Um, and the next slide. So before having any conversation, ask like if you're talking to a client or a practice member, um, maybe she's already on one. Ask her what she's using. Um, if she's considering going on one, like start to paint the picture for her that there's some options out there. Okay, the wild yam cream is not progesterone. And I want to dive into this because a lot of people think it is, especially on the crunchy side. And I live probably 80% on the crunchy side. Um, here's kind of the timeline I came across. In the 1940s, chemistry labs experiments are real. Diogenin was the starting point for pharmaceutical hormone production. And that's why people started to trust it. Um, by the 1980s, this is where this leap in thinking and assumption happened. And it's not fraud, it's just a logical sounding mistake that spread through the wellness culture. Um, you know, oh, sorry about that. The it just kind of like basically in the lab, it was a starting point for making progesterone hormone, but it's never been proven really to support in real life humans. Um, today's research, it doesn't raise progesterone levels in the human body. Like I haven't come across any research. So if you have, please let me know. Um, some women may feel better, right, because of the placebo effect. Some products that are wild yams secretly contain USP progesterone. Um, and they should have a label, an alert label at the bottom. Like that would be fraud if they don't. And then there's the mild adaptogenic effects from plant compounds. So, it's not terrible. And it works for some women, but just letting you know. I wish it worked. I really did. Because that would like just be amazing for the crunchy side of me. Okay, so some of the clean over-the-counter brands. This is a very practical recommendation. Um, if you're a coach or a practitioner, just know these names. If you're a mom searching out clean over-the-counter products, check these out and then consult with your health team. Even though they're over the counter, I think this topic, like, definitely have an outside opinion before you start messing with hormones. Um, Raina, Raena, it's a newer brand, a cleaner label. And this one actually offers 50 milligrams and 75 milligram options, whereas I mentioned earlier, most over-the-counter creams only give 20 milligrams per dose. So that's a meaningful difference. Nat Pro is one of the most commonly recommended over-the-counter brands recommended by functional medicine practitioners. It's aloe-based, it's a clean label. I've seen it recommended a ton. Progest E, this is the Ray Peat influenced option, progesterone and vitamin E oil. If a client is ultra ingredient conscious or wants the absolute simplest thing, this is it. Um, and you apply it in small drops, not pumps. There's also a product called Emrita, Emerita. It's the most accessible. You can find it at Whole Foods. Not as clean as the others, but better than a standard drugstore brand. All right, so the clinical windows. This is no, definitely do like I'm sharing with you an overview. Definitely do deep dives before, like I said, even using the over-the-counter brands, especially if you're in one of these clinical windows. So the luteal phase, this is often the most common entry point for women. Um, this was definitely an entry point that I could have used. Um, but I worked on lifestyle and stuff. My progesterone was definitely low after a big stressful season, according to a Dutch test. And then, I just very, it was very intentional, and it took about 6 months, improve that. But anyways, okay, the luteal phase, the pattern to recognize. So symptoms are worse in the 10 to 14 days before her period, so that 2 weeks-ish. Irritability, anxiousness, can't sleep, breast tenderness, and then it resolves with the bleed. That's usually a luteal phase issue. So you would take some over-the-counter progesterone, usually between days 14 and 28, um, after ovulation, and then stop at bleeding. It's a simple protocol. But like I said, this is not health doctor advice. Go down this rabbit hole, research for yourself, ask your provider, ask your whoever's on your health team. Perimenopause, y'all, this is the most misunderstood window. I think there's still so much research that needs to be done here. Progesterone starts dropping in our late 30s before progesterone, but I will say it's probably mostly lifestyle related. And most of the time, women are simply depleted and exhausted. Um, so let's address lifestyle before we just try to go for a band-aid hormone replacement fix. Um, if it's a late 30-year-old, early 40-year-old, sleep problems, mood changes, heavier periods, probably an early menopause with progesterone insufficiency, but I don't know for sure, right? Do your own research. Um, Once you're having hot flashes, then you're like down, way down the perimenopause hole. So just check it out. Postpartum, the progesterone cliff after delivery is one of the steepest hormonal drops. Um, but y'all, lifestyle foundations first, sleep, nourishment, nervous system support, community. Then consider, especially if and when her cycle returns, then consider luteal support. Um, I would not do any sort of hormone management prior to her cycle returning. That's just me personally. Um, Remember, this is not health advice or wellness advice. You got to consult your team. Um, and those are the four clinical windows. So, where would you apply this? This seems like a simple, practical thing, but oftentimes this gets overlooked. If a client is applying correctly dosed progesterone to the wrong site, she may get poor results and conclude that it doesn't work, or be passing, like transferring that cream on to somebody else in her family. So first of all, think skin over blood vessels. You want the cream to absorb into the bloodstream, so not on thick skin or subcutaneous fat where it can accumulate. You gotta rotate it. Applying to the same spot every day leads to receptor downregulation at the site and fat accumulation of progesterone. The stored fat progesterone can then release unpredictably. So, oh, one other thing here. The palm issue. This is an important clinical history. A lot of early studies on transdermal progesterone used palm application, which showed poor serum uptake. And those results were used to argue that topical progesterone doesn't work. But palms are possibly the worst site. Um, Most recent studies using proper sites show much better conversion. So just know that. Evening application support helps um, via the allopregnanolone, and some practitioners will recommend splitting the dose morning and evening. Um, so just something to think about. Something to think about. I did want to, let me see. Let me see if I can pull this up. I gotta, oh, right there. Okay. I had to make a note because I'm looking at my notes and that didn't make sense to me. So let's talk. Oh, before we move on, I do want to say, um, I mentioned evening time. That seems to be the most common time, but the most used or places of the body where progesterone can be applied with skin and blood flow are the inner wrist and forearm. That seems to be a go-to for women because it's easy access and you can rotate. I would just be mindful not to rub it off on a child or a husband or a partner. Let it kind of sink in. Inner thigh, large surface area, obviously, it's great for absorption. And upper inner arm, thin skin, vascular, easy to hide under sleeves. Also common are chest and upper breast tissue, lower abdomen, and behind the knees and neck. As we discussed earlier, rotation is key. The same site every day leads to receptor downregulation. Um, and I mentioned avoid the palms of the hands. All right. So, oops, oops. Okay, let me just pause this. All right. Well, I didn't press pause, but y'all got a TV timeout. All right, so let's talk about the seven pillars. Because if you're not going to address lifestyle factors, you're not going to get to the root thing. And this is what separates a BirthFit coach, a BirthFit practitioner from a generic practitioner, a generic coach with just a supplement recommendation. That's literally a band-aid. Um, every pillar has a direct measurable relationship with progesterone production, conversion, and receptor function. So the sun, hello, LH surge timing, that's going to influence, right? Our circadian rhythm influences every physiological response in our body. Sleep, that's going to influence pregnant alone. Um, Fitness, ovulation threshold, nourishment, um, obviously, you need to be nourished. Hello, cholesterol. Let's get some cholesterol in us. I've seen y'all low cholesterol. Oh, that's a whole rabbit hole. But make sure you're eating animal products. Let's just go there. The HPA, HPO access links. So, um, that's like nervous system related, feeling safe and not safe enough to ovulate to reproduce. Community, that's that oxytocin. You need cortisol, but like it doesn't need to be high all day, every day. And then spirit, sense of purpose, sense of meaning. That was a big, fast overview. Um, so if we dive a little bit deeper into these pillars, let's let's just for the sake of circadian rhythm, because everybody overlooks this. Circadian rhythm governs the LH surge, and without proper light input, the HPO axis loses its timing signal. Ovulation, so O is ovarian. Ovulation is disrupted before any other symptom appears. So what do you do? 10 to 20 minutes of morning sunlight within, I would say immediately upon waking, but for sure within the hour. It's got to be on your naked eyeballs, no sunglasses, no glasses, just eyeballs up to the sky. Um, Make a hard stop. Yes, I know that this is hard for me too because sometimes I get the opportunity to work at night when my little one's sleeping. Put on blue light blockers, try to make a hard stop, 60 to 90 minutes of screen time before you go to sleep. And that will really support melatonin. If you're postpartum, get outside. Get outside, even if it's for 5 minutes here and there, every hour. Check your vitamin D levels. That's going to go a long way. So, sleep deprivation will raise cortisol, which that's cortisol is going to compete with progesterone for the same precursor, pregnenolone, the steal pathway. Less sleep equals less progesterone and more cortisol. This is why circadian rhythm, your flow, your rhythm, all that matters. What does your sleep hygiene look like? Your sleep architect. Are you sleeping in a cool, dark, quiet environment? Um, Night waking could be perimenopause or allopregnanolone deficiency. Just there's a number of things it could be. It could be liver related. Um, if you're newly postpartum in that fourth trimester, try to get one solid block of 3 to 4 to 5, 6 hours. Um, Address wired and tired patterns. That usually means elevated evening cortisol. I do want to touch on fitness because if your available energy, your energy for training, your energy for making a quality egg, if that energy is low, if your training load is exceeding your caloric intake, you're going to suppress a lot of things in the ovulation pathway. And if there's no ovulation, there's no corpus luteum, there's no progesterone. So assess your training load versus intake. Um, Prioritize resistance training over high intensity interval training. Um, I think a lot of us, myself included in the past, if I went hard, if I had a workout that left me on the ground, like, I gave it all I got, multiple days a week, that's that is a big energy expenditure. And as women, our bodies need energy to make a quality egg and then to ovulate and then to release progesterone. Um, Luteal phase, we fluctuate throughout our cycle. We might have a bit of a reduced capacity. It's not a weakness, it's just different. It's just what it is. We are women, we're wired differently than men. Um, if you're postpartum, honor that season, honor that fourth trimester. Check out our postpartum package. It's designed for a reason. Do the line-in, do the BirthFit basics, then get back into postpartum training. Um, you know, when I see women jump back into high intensity interval training early postpartum, I just see a mess of hormones. Just a mess. Um, okay, nourishment is a big one, and progesterone is made from cholesterol. So fat plus key micronutrients they're not an option. Like you have to get those. So when I see somebody saying, "Oh my God, I'm trying to get my cholesterol under 200," I'm like, "Oh, please no. Please no." Um, you got to have blood sugar stability. You got to have some vitamin C, B6, zinc, magnesium, vitamin C. Oh, that's so important for progesterone. Healthy fats, eggs. 2 eggs a day are not enough, y'all. I eat 4 eggs a day, minimum. Red meat, butter, olive oil, avocados. Under eating will suppress the production of progesterone at the source. Um, we talked about stress. Chronic stress will shunt the production of pregnenolone over to cortisol, and the nervous system is endocrine medicine. So, where can you slowly exhale more? Where can you add in some restorative movement? When can you get outside and put your bare feet on the ground? Are there any stressors in life that can be removed, honestly? Um, it's big work, I know. And then community, who's in your corner right now. If you're isolated, your adrenals are probably taxed. If you don't have community support, if you're not a well-resourced woman, your adrenals and your kidneys are probably like, "What's up? When are we getting support?" And absolutely, if you're a coach or a practitioner, you have to be adamant about women resting in the sacred season in that line and month because it will influence their hormonal health for the rest of their life. I guarantee it. Um, and then spirit, what gives you a sense of meaning right now? Do you have a prayer practice? Are you going in nature? My nature for me is a huge prayer practice, and it's a big deal for me. All right, so some red flags. Uh, If you've addressed lifestyle components and we've still got some of these red flags going on, and you have not referred out or you haven't sought out additional support or guidance, do it. Don't be silly. We got support out there. You can check the BirthFit directory first. If not, please ask for local referrals. I think in person is a hugely beneficial way to go. But also, or I should say, and also, we're at a time where virtual um, consultations are out there, and it's not a bad idea. So irregular bleeding, spotting outside of the cycle. Um, if symptoms get worse with the cream, that's kind of a red flag to me. If there's severe mood changes or worsening of depression, if there's breast lumps or new breast changes, that's a big one. If there's any history of estrogen sensitive cancer, um, if there's no improvement after 3 months, that's kind of like, hey, we need another set of eyes on this. Um, if you're using progesterone during the first trimester of pregnancy, I would definitely have another set of eyes. Um, I think that's a big deal. All right. All right, here's a question. Can I use both yam and over the counter together? The short answer is there's no known safety concern with using both, but you're not you're not really stacking two progesterone sources. They're using one actual progesterone intervention alongside a botanical. Um, so that's the short answer. The deeper thing is there might be confusion, um, just kind of about the mechanisms and everything going on. So this is why I think having a team support is huge. Okay, that was a good question. Let me see if I want to cover anything else with y'all. Okay, so I talked about labs in the beginning. If you're okay, yes. So Dutch test, if you want to really truly know progesterone levels, get a Dutch complete panel, and you're gonna measure. It'll tell you exactly how to do everything, but you're measuring at different times of the woman's cycle. She's measuring it at home. Um, if you're doing blood labs, you want to get serum day 21. You can also do some saliva hormone testing. Um, I would also, within this, get a full thyroid panel. And then you could do some sex hormone binding labs. Those are great places to start. Um, and then I think we hit everything. So, we hit about the three tiers. We talked about the yam myth. We talked about clean over-the-counter options, lifestyle pillars, and then, when to definitely refer out or get another set of eyes. Y'all, I cannot stress, I know I said this before, but lifestyle pillars. If you do not address lifestyle, this problem will always be there, and you will constantly be putting a band-aid on this issue. So you've got to reevaluate your lifestyle practices here. No matter if you're trying to conceive in that perimenopause phase, whatever, like you've got to address your lifestyle. So check out the BirthFit community and BirthFit directory. Let us know if you have any questions. Hope you enjoyed this episode. Thanks, y'all.